Lovely to have you with us. Will Quince, we spent the day yesterday in a hospital in Lancashire, and what's really clear from speaking to those nurses is that while they are all really determined to do their job properly, they are also incredibly fed up. And the thing that they kept coming back to was that if you paid staff better, they would keep the staff that are currently leaving, and they'd be able to attract more people into the profession because they'd be proud to work there. Do you agree with them?
Well, I certainly agree. The nurses, and in fact all those who work for the NHS, do the most incredible job, and I see that, as I know you did up at Chorley Hospital. I think there are a few things on that. The first is, do I want to see nurses and those who work in the NHS properly remunerated for the incredible work that they do? Of course I do, and that's why we're committed from April of this year to a pay rise, and it's why this year we accepted the independent pay review body recommendation in full, and why last year, when the rest of the public sector had in effect a freeze, those who work from the Agenda for Change contract or NHS got a 3% award. But I understand the pressures that not just nurses and those who work in the NHS, but all those are facing at the moment, whether they work in the private sector or the public sector.
When you talk about that pay rise that's going to come in the new year, I don't think you've submitted your evidence to the pay review body yet, have you?
Not yet, but I understand that's going to happen, and it's going to happen across government. So there will be different government departments doing that, I think, at the same time.
And the reason for missing the deadline, is that because you are in talks about giving a more substantial pay rise, potentially even as much as 10%, maybe not that much, but a bigger pay rise than you usually would have?
So I'm not going to go into the detail, and some of that is above my pay grade in any event. But what we do have is the independent pay review body process, and they make a recommendation, and the government either accepts that or rejects that. What the government does do, though, is put forward affordability criteria. The NHS budget is no secret. The Agenda for Change contract is around 1.245 million people, so it means for every 1% it is about £700 million. So these things are tricky, but of course I meet with the unions. I know it's not just about pay, it's about working conditions and working environment too.
Yeah.
And those are issues that I want to work with them to address.
Yeah, because some of the nurses were telling us yesterday, I mean, they're working often in departments where they don't usually work, they're not trained on the equipment, they have to cancel patients, they get a 30-minute break in a 12-hour shift. That doesn't seem acceptable to me. It certainly seemed like a lot for what they're doing.
Well, workforce is a massive issue, and I know agency staff and the nature of bank work means that you're not always working on the same wards, and it does mean there are issues with consistency. And it's exactly why, as part of the long-term workforce plan, which we've commissioned NHS England to undertake, we're going to look at these issues. But I mean, there are more staff in the NHS than there have ever been.
Yeah.
So compared to this time last year, we've got an extra 10,900 nurses, an extra 4,700 doctors. But I know how it feels on the wards, and I know that's not enough. And of course, all these extra beds, like we announced in the Urgent and Emergency Care Recovery Plan, they've all got to be staffed. So the more, in effect, capacity we create, the more staff that we need. We're very much alive to it. And as part of that long-term workforce plan, we're looking for the next 5, 10, 15 years to ensure we've got the workforce fit for the future.
Are you going to put the money behind increasing staff numbers? Because the other thing that came up yesterday was the ward we were in, it did have capacity to do more surgery. They've actually built more theatres in the hospital to do that, but they don't have enough staff to be able to nurse that effectively and safely. Are you going to put more money into getting more doctors and nurses and frontline NHS staff?
Well, I mean, the short answer to that is yes. So we're putting an extra £3.3 billion this year and next year into the NHS. We've then got the long-term.
But not all of that will go on
plan.
staff, though. So how much is going to be extra on staff?
So it won't, but the staff is a significant part of the NHS budget, understandably, with 1.245 million people, plus then doctors and senior managers. And I think it's inevitable, really, when you look at some of those challenges, that the long-term workforce plan is going to play a part. We're boosting international recruitment, which I know is an important part too. We've got more domestically being trained too. So compared to this time last year, across the NHS, it's about 41,000 more people. But it's easy for me to give you a number, but I know how it feels on a ward. I know that nurses struggle and managers struggle to fill their rosters. It's why it is the biggest challenge that the NHS faces. It's why we've got that long-term plan, and it's something that we're committed to addressing.
Does it worry you that nurses are so frustrated, they are angry, they are tired, some of them are leaving to go and work in other professions like hotel, bars, restaurants, because they can be paid more. Does that concern you?
So of course it does, and I know cost of living pressures impact on everyone. I want to be keeping the very best within our NHS.
So what would your message to them be?
Staff. So stick with us. We have got the independent pay review process for next year. The important thing is we're working with unions. I want unions to engage with that process because I understand the importance of retention. The NHS is still a fantastic place to work. It has a brilliant pension, as you know, up to 33 days paid leave a year. But I know that there are cost of living pressures out there. It's why we're committed to that independent pay review body process. And from April, we will look at that recommendation that body presents, and then look at it very carefully, and then come to a conclusion.
So trust you, stick with us, trust us that we've got
this.
Well,
look, I hope so, because I genuinely want the NHS to be the best place to work in the country, but really the world, because we are looking to attract people from all over the world to come and work here. I am, as much as anything, I'm not just the government's representative to those who work with the NHS. I'm the advocate for those who work within the NHS in government, and I'm making the case for them. I know how important recruitment and retention is, but when I speak to nurses and others, they also tell me it's not just about pay, it's about feeling valued, it's about the working conditions, and I think we have a lot more to do in that space too.
If you had your way, would you pay them more?
Of course I want to see all public sector workers paid more, and I would not want to be the Chancellor. He has an incredibly difficult job balancing three things: making sure that public sector workers are properly remunerated for the incredible job that they do, and making sure that we're retaining and recruiting the very best, ensuring that it's affordable, but also that it's fair to other taxpayers too.
Taking a step back and thinking more broadly, obviously, what you do here in this department is think long term about the NHS. Is the system that we have right now, seeing your GP, ending up in hospital, is that working, or do you need a more fundamental overhaul and a rethink about the NHS?
So I think the last thing the NHS needs is another big top-down reorganisation. It's had far too many of those. And actually, if you look at the reforms that have been made, they are still embryonic. They're early stages. So integrated care systems, for example. So for the first time ever, we are seeing join up between primary care, between dentistry, between adult social care and acutes. And that's still at early stages. Most of those integrated care systems and integrated care boards started in July. So we've got to let that embed. But it is that join up that's going to be, in effect, the future of the NHS, making sure that every part of the system is working to the same objective.
So if the answer isn't a fundamental overhaul, and right now you can't do much more in terms of pay, or you can't say much more in terms of pay, would you consider a subscription type service or a payment for those who can pay, like NHS dentistry, perhaps?
No, I don't think it's the right way to go for a number of reasons. I mean, I'm a big passionate defender of the NHS being free at the point of use. When I've had some of my darkest days in the NHS, and the last thing I would have wanted at any point there to think about was how am I going to afford to pay the bill for all of this. That's not on the table. I don't think it will be on the table under any government.
Your colleagues have suggested it, some of them.
Look, I genuinely don't think it. Well, I would fight that vociferously, and I don't think there is any government of any colour that would suggest such a thing. But I think there are ways in which we can reform the NHS through transformation, and that's about innovation, it's about med tech, it's about life sciences, things like genomics, which means we'll be able to treat people more effectively, more efficiently, faster, using the latest targeted medicines, which will get the right medicine to people faster, closer to home, being able to diagnose and identify conditions earlier, see who's predisposed to certain conditions like diabetes and heart disease, and making sure that they get screened and treated earlier. That's the future of the NHS, and it's actually quite exciting. That's the way that we reform the NHS, not through big top-down reforms, but through transformation and innovation.
Yeah. How about if somebody wanted to pay for NHS treatment? Should the government help facilitate that?
Well, people can already. They can go private, and some people do have private GPs.
But if people wanted to contribute to the NHS, if they thought, you know what, I've got enough money, I should be paying for this. The NHS is really struggling. Should the government help them to do that?
People do that already, and I'm taking back to a particular example where my wife and I lost our son. We wanted to contribute to the NHS. We wanted to say thank you, and we did that. And we made a sizable donation with a number of our friends and family to the NHS Trust, and people do that day in, day out. So I think there is a model already that works for that. Philanthropy as part of the NHS and healthcare is already there. I don't think we need to formalise that in any way.
Would you encourage people to do that?
Yeah, look, I think any way in which we can say thank you, and some people will do that for staff, so they'll want to invest that in staff facilities. Others will want to do it in ways in which they, for example, if you did lose a baby, you might want to say, I'd like to invest in the bereavement suite. I'd like to put some money into cold cots, for example. So some of the more add value things which the trust may not be able to afford. A lot of people who go through cancer and survive cancer will, or whose family sadly don't survive cancer, will want again to ensure that the facilities in a hospital are as the best that they could possibly be. The environment's beautiful and one
it's
that
a really
that they
lovely
would want
thing to have done that you did.
But people do this day in, day out in our NHS. They want to find ways to say thank you for something that they had free at the point of use, but they want to say thank you for doing that. And it wasn't just us; it was all of our friends and family all contributed, and it was something people want to do to say thank you and give something back.
Talking about saying thank you, I mean, of course, in the pandemic, it's something that everybody did. Everybody clapped outside of their own homes. But there's a real worry now about strikes and the impact that those are going to have, because ambulance staff, nurses are about to walk out on strike, and there are lots of worries about what will happen to patients during that time. Some people might ask the government, do you really think it's worth not talking to them, not giving ground on pay? Because ultimately what you're doing is saving, I think, £3.8 billion. That's the cost of a 10% pay rise. Is it worth it for that amount of money? Because you're talking about people's lives.
Well, you're right in some ways in that, I of course go into every strike day working out exactly how we're going to have all the mitigations in place to ensure that we have those minimum levels of cover. And the really important message is, if people do have life-threatening emergencies, it's still really important, even on strike days, you call NHS 999, and if you don't, NHS 111 or NHS 111 online is there available for you too. But of course, you talk about 3.8 billion, but in the context of, take my context, for example, NHS budget I have responsibility for of £153 billion. Actually, £4 billion is a huge amount of money. Every 1% is about 700 million. And I rightly get asked questions about the backlog and the millions of people that are waiting for surgery, about urgent emergency care, about people waiting too long for ambulances. Every 700 million is 700 million that I will have to take out of NHS services currently in operation. Now, the only other way is, of course, through the Treasury. I could go to the Chancellor and ask for more money, and he has to weigh up what's affordable for the country, but also what's fair to other taxpayers too. And there are lots of other taxpayers, some of whom my constituents, who will earn between 30 and 40,000, so very similar to those who work in the NHS, but they don't have 20% pension contributions. They don't have up to 33 days paid leave.
No, but public opinion is behind the
NHS
right, staff.
But don't forget, private sector workers have also only received pay rises of between 4 and 6% over the course of the past year.
But they can move, of course. They can go and work somewhere else. Within the NHS, it's very difficult to do that. You can't go and find another job unless you leave it.
Yeah, and I very much recognise that, and I recognise the cost of living pressures, as does the government, which is why that additional support around energy has been put in place. But it's also why we've got this pay review body coming up, and it's why I'm working closely with the unions to ensure that they're submitting evidence, and that pay review body can get it right, and then we can look at that recommendation, which would be implemented from April.
Just finally, I mean, thinking about what we've talked about, the pressures on the NHS, you've mentioned them yourself, thinking ahead about the strikes, about staff leaving, about staff sickness, about morale in the NHS, which is pretty low at the moment. Do you think the NHS is now in crisis?
I think the NHS is under considerable pressure, and it certainly was between Christmas and the New Year. We've put in place a number of measures to address the issue now, that 500 million discharge funding, an extra 250 million to, in effect, block book care beds. The system's under huge pressure, but I'm not going to use that word, because actually the vast majority of people every single day get excellent care and excellent service from our NHS. Have I got work to do to make sure that we build resilience, not just now, but for next winter? Of course I do. And there were things that were particularly unique this year, like flu, for example. I mean, between Christmas and New Year, had around 5,000 people in hospital with flu.
But there are thousands of extra
35.
people dying. I mean, the excess death figures are really worrying. The ambulance wait times are, in some cases worse than people have ever thought would happen. How is that not a crisis?
It's certainly huge pressure on the system, and I'll be the first to say that some of the ambulance response times in December in particular were unacceptable. They're unacceptable to me, they're unacceptable to you, and they'll be unacceptable to many of your viewers. They have improved significantly since. Last week, and average was 25 minutes against a target of 18 minutes, which was our pre-pandemic.
Yeah.
But we've got to keep that up, and I've got to ensure that we have resilience in the system, not just for now, but for next year. So if flu does come early, if it comes like it did this year, 100-fold greater than the year before, that we have the bed capacity, that we have the staffing to be able to tackle that issue head on.
Will Quince, thank you very much.